From more tests to free masks, the Bay Area is getting some new tools in the fight against COVID-19. And tonight, the World Health Organization says that there is, quote, plausible hope for a return to normalcy soon. This is as the FDA is preparing to make some changes this week as well, changes that Governor Ron DeSantis is already pushing back on.
So we hope for the best and prepare for the worst.
Some hope coming from the World Health Organization. The Omicron variant spread so quickly, health leaders now believe cases should be peaking soon. In the Northeast, the variant appears to have already peaked. Here in Florida, the CDC is reporting another 36,000 cases and no new deaths. The percent of tests coming back positive, that has also been slowly on the decline, according to Johns Hopkins.
Most likely, in Florida, it is Omicron.
For months now, Governor DeSantis has been touting the state's monoclonal antibody treatments. But this week, the FDA is looking at possibly placing limits on those treatments. Studies show it's not effective against Omicron.
Well, they've been messing with our monoclonal antibodies for months and months. What are they keeping it for? I mean, you don't know what's going to come down the pike.
As for testing, a new site opened in Tampa today in the parking lot of Adventure Island. They'll be offering PCR and rapid antigen tests now every day from 9 to 5. Free high-quality masks will also be available this week. Southeastern Grocers says customers will be able to get N95 masks at pharmacies in Winn-Dixie, Harvey's supermarkets, and Fresco y Mas stores as early as Friday.
All of that as scientists have now identified a subvariant of Omicron called BA2 in at least 40 countries. It's being called stealth Omicron because scientists say it can't be distinguished from other variants on the PCR tests that public health officials use. To get a sharper insight, we spoke with Dr. Michael Tang. He studies immunology and infectious disease at USF Health. He says this subvariant of Omicron seems to operate the same way as the initial variant, and it is not cause for alarm.
It's interesting scientifically, but it's not going to affect your day-to-day life. We had variants of Delta, for example. There were at least 3 variants of Delta. It really was not, it doesn't change how you should approach your life. You know, get vaccinated, get boosted.
It's good for scientists to be able to study how this virus mutates. He says if you have Omicron BA2, you'll still test positive for COVID on a PCR or even an at-home rapid test. It's just that further analysis is needed to determine which variant it is. He says it's likely in the United States at this point, but because we only sequence about 5 to 10% of cases nationwide, it has not yet been detected. Dr. Tang also added that just like with the original Omicron variant, this one seems to have mild medical implications for those who are vaccinated and boosted. But mild is a relative term because Omicron is still causing hospitalizations and even deaths among the unvaccinated worldwide. Get up to speed on all things COVID related by texting the word coronavirus to the number on your screen, 727-577-8522, and we'll send a link straight to your phone.